For our project, we had Down syndrome. Down syndrome is one of the most common chromosomal abnormalities. It occurs approximately 1 in 700 live births in the US, and a test of pregnancy-associated plasma protein A may also indicate a risk for Down syndrome. Along with this, it's caused by an extra copy of chromosome 21 in every cell of the body, resulting from an error in cell division called non-disjunction during the formation of sperm or egg cells, which then leads to a variety of developmental and physical abnormalities due to the altered genetic expression from the extra chromosome 21.
Risk factors and physical signs. A couple risk factors include maternal age, especially about age 35 and over, and about half of babies with Down syndrome are born to older mothers. Exposure to environmental toxins, and Hispanics also have more probability of being at risk. Physical signs include flat nose, bridge, small ears, hands and feet, slanted eyes that point upward, and shorter than average height.
So, as far as for Down syndrome, there's no specific medication that is designated to treat Down syndrome, but varying, some kids with Down syndrome can have like heart abnormalities or sometimes like physical abnormalities. So some of them can get treatment for that. But as far as medications, majority of children with Down syndrome go through like behavioral therapies to kind of try to improve their cognitive function, as well as occupational therapy, physical therapy. They will go through speech therapy, and then they will get educational support in schools. And that's as far as treatment for kids with Down syndrome.
Labs and diagnostic studies. There are two types of tests for Down syndrome that can be performed before baby is born: screening tests and diagnostic tests. These tests do not tell you for sure whether fetus has Down syndrome. They only provide a possibility. Screening tests for Down syndrome is offered during first trimester of pregnancy, includes an ultrasound assessment of the thickness of nuchal fold called nuchal translucency and absence of nasal bone. A second trimester quad test involves testing of the blood levels of AFP, unconjugated estrol, UE, inhibin a placental hormone, and HCG. A low AFP or a high HCG and inhibin A with low UE may indicate a high risk for Down syndrome in the developing fetus. A test of pregnancy-associated plasma protein A, PAPPA, may also indicate a risk for Down syndrome. Positive tests in the first or second trimester may indicate the need for amniocentesis to confirm diagnosis.
Nursing interventions promote growth and development, encourage early intervention programs, physical, occupational, and speech therapy, ensure airways and respiratory health, monitor for the signs of respiratory infections, example pneumonia, support cardiovascular health, monitor for the conjunctive heart defects, example murmurs and sinuses, address gastrointestinal and nutritional needs, monitor for the signs of feeding difficulties, constipations, and encourage high fiber diet and adequate hydration. Promote skin activity, assess for dry, cracked skin, and recommended moisturizing lotion.
Patient teaching. Regular medical checkups are essential for monitoring growth and development. Speech, occupational, and physical therapy can help improve skills. encourage a healthy diet, physical activity, and good hygiene. People with Down syndrome can lead fulfilling lives with education and social interaction, encourage participation in school, community activities, and interactions, join support groups for guidance for emotional support, stay informed about resources, special education, and advocacy opportunities.
Conclusion: Down syndrome is a genetic condition caused by an extra copy of chromosomes 21, leading to the development delays, intellectual disabilities, and characteristics physical features. While it presents challenges, early interventions, medical care, and educational support can significantly improve the quality of life for individuals with Down syndrome. Continued research, awareness, and society support are necessary in promoting inclusion and ensure equal opportunities for people with Down syndrome. Thank you.